Welcome back and good morning, Kuwait. Definitely we have, Mr. Thamer Ibrahim Arab Health Insurance Hospitals, who's going to tell us about the health services and which offered by the company, covering all public hospitals, expats, patients in Kuwait. Sarah.
Exactly. The company's mission is to provide the full spectrum of integrated healthcare services through leading a holistic network of primary healthcare centers and hospitals as well.
Definitely, we'd like to welcome Mr. Thamer Ibrahim Arab, CEO, Health Insurance Hospitals Company, and definitely it's ضمان. The word ضمان, definitely. It's first of all, thanks for joining us, and thanks, really to come up to this studio and explain exactly what this all project is about. And good morning, Kuwait.
Good morning.
Good morning,
Good
Mr.
morning.
Thamer.
So let's just start. First of all, can you tell us about who is Health Insurance Hospitals Company?
Yes. First of all, thank you very much for hosting me in this exciting show and this cold day, as I heard earlier.
Yeah.
And I'm honored actually to be here and to give an idea about Health Assurance Hospitals Company. ضمان is actually part of a governmental initiative that started maybe 10 years ago. It was the vision of Kuwait, New Kuwait 2035, and it is one of the main healthcare pillars of that plan actually. It is established based on a Council of Ministers resolution 586 in 2010. 1815, 2010.
Yes.
And actually, it is the first HMO model, health management organization in the Middle East. It is the first public-private partnership, which is a government initiative, actually.
Yes.
And it is the first company that will be an IPO in the health sector. It is supposed to serve around 2 million expats that are actually in Kuwait. So the government really had a vision that in order to cover this big sector that we have in healthcare, they adopted this health management or maintenance organization model. It is not a new system actually. It is a system that started in the United States of America in 1972, and it is based on preventive awareness.
Okay.
So the model actually is, in short, it covers the health insurance through the health facilities of the company for a specific segment for a fixed price, which is the closed HMO, as they say.
That's really great.
That's
You
amazing.
mentioned briefly about when it started 10 years ago.
Yes.
And who's going to be covered by
Yes.
that. But we'd like from you to elaborate more exactly who would be covered by ضمان and how is going to work.
Very well. The mandate actually targets expats that hold Article 18 and their families.
Yes.
This actually, it includes in the services itself, it includes the diagnosis.
We're talking about non-Kuwaitis.
Non-Kuwaitis,
Okay.
non-Kuwaitis.
Okay.
It includes the diagnosis, the consultation, the treatment, the medication. It has primary healthcare and secondary healthcare and some specialized services. The primary healthcare, actually, we offer family medicine or family consultation, pediatric, dentistry or dentists. We also have the services of radiology and medication. And the secondary, which is the larger part of it, is we offer much more specialized services like internal medicine, surgery, ER, intensive care. We also offer orthopedic, and we also have some delicate surgeries in cooperation, of course, with Ministry of Health. Ministry of Health is the driving force behind actually ضمان, because one of the big purposes of ضمان's existence is to at least take some of the pressure of the Ministry of Health on their medical network that they have. which I'd like to take this opportunity to salute them basically for all the efforts that have been spent into fighting the 2-year global pandemic. They've done a phenomenal job into controlling this pandemic.
That's nice. So when it's starting?
Today we have already 3 PHCs operating.
Okay.
We have one in Hawali, we have one in Rajij, and we have one in Farwaniya. And we have around 76 clinics already in these 3. We have 2 that are being...
So what does ضمان mandatory health insurance covering?
Mandatory health means it is the consultation, the diagnosis, the medication.
Treatment, yeah.
And the treatment itself. Mandatory means it's mandated by the government for this specific sector that they are going to be covered through ضمان itself. I want to also mention that we currently are building 2 state-of-the-art hospitals, huge hospitals that we have, which I will elaborate in a bit more detail in the coming...
For sure. Mr. Thamer, what about the insurance policy that ضمان follows regarding the providing of mandatory health insurance?
The insurance policy basically, it is targeted toward the segment. And as I mentioned, it actually covers all the basic needs that the targeted segments require, from the treatment itself to the inpatient, to the hospitalization, to the medication, to the radiology services. It also covers lab with all the different types of lab, you know, hematology, biochemistry, you have also virology, toxicology, all the different types of lab tests, that's also covered. For the radiology, it covers the X-rays, the CT, the MRI, even we have also the sonar. That's all covered within the same insurance policy. Because the idea of the HMO is basically to do the prevention and the education properly, so you actually reduce the number of visits that you have. If you have a healthy community and you populate that, then you reduce the pressure that is actually being put.
Absolutely, on the governmental,
network.
know, health institutes. Definitely, all the premises of the governmental health, we can see how they are really crowded. Definitely when you have, ضمان, something, really take off the burden.
Definitely.
And if we talk about, or take us through the services. I mean, the health services you are providing. For example, when we go abroad, definitely some health insurance, they say, listen, if you have a disease just took a place, not before you sign with us, that's one issue. Second, okay, we'll cover everything except, doing any dentistry, we don't cover that. So sort of that kind of thing. Tell us about, this.
Definitely. What we have is we have the family consultation and medicine and treatment. We have the dentistry, which is the basic requirements of the dentistry, and we have the pediatric. This is what we call is the primary healthcare, which is the gatekeepers. Now, when you go to the secondary healthcare, then it becomes a bit more complicated because we have other services that we offer, including even surgeries. We have, the ER. We have the orthopedic, we have the gynecology, we have the...
Absolutely.
All of the basic...
All sectors,
Yes. Now, there is another level called tertiary, which is the more complicated, very complicated cases. There is a protocol between us and the Ministry of Health, where the tertiary services will be covered by the ministry, because they are actually specialized services, including cancer,
more knowledgeable,
open heart surgeries. And the Ministry of Health, they have a vast experience in that, and resources and equipment.
Absolutely.
But all of these basic services, definitely, they are covered within the policy of ضمان itself.
That's really amazing. So, Mr. Thamer, you mentioned about the hospitals.
Yes.
So, they are currently under constructions.
Yes.
So, when are they expected to be delivered and operate exactly?
I'm glad you asked me that question, because the hospitals, and I have some emotional connection with the hospitals, because they are actually built, it's a state of the art, the 2 hospitals that we have. We have 2, one in Jahra and one in Ahmadi. Currently they are being built, and we are reaching a percentage close to 70. Now, why I have a soft spot for the hospitals? Because the way they are built, they can actually compete with any new modern hospital being built. I'll give you some simple examples.
Right.
Each hospital is built over 80,000 square meter. It has 300 beds. There are around 14 different operating rooms that we have. We have almost 75 clinics. We have 21 operating theaters.
Wow.
There's 1,700 square meter of lab, 1,750 of pharmacy, and I also have around 5,000 for an ER. And we also have a helicopter or helicap that we have for the emergency services.
Wow.
So it's the hospital itself, if we combine both of them with 600 beds, this is actually achieving the goal of the Ministry of Health and the government, where we reduce and we increase the bed capacity. So today the government also will move some of that burden into these hospitals.
So we wouldn't have this kind of thing, you know, we are as Kuwaiti citizens, we don't have much space in some hospitals, and
then you can, yes,
you know, I mean, this will be really vanish by the
It's a very valid point that you mentioned, because indirectly, when you reduce the pressure, then you benefit the Kuwaiti citizens, because now you do somehow an equivalent distribution.
Of space and time. That's amazing. So let's go for some human cases, you know, for example, Mr. Thamer. Definitely, I understand, you know, doing the preventive, and you know, this is really a beautiful project and solution. But you know, sometimes, let's face it, there are non-Kuwaitis. They have nothing. You know, I mean, I know it's not like usual case, but you know, definitely you come across them. Like this shows, you know, how human we are. I mean, you have something for that, or it's definitely, I don't know, like, how would you respond?
We are in the healthcare sector. So healthcare, again, as you mentioned, it's a humanitarian purposes. So should the case require for us to look into such cases.
For example, he doesn't have money or stuff like that.
We will definitely not stop at this level.
Okay,
because
good.
as I mentioned, at the end, we are here to treat and we are here for the well-being of human. Yes, today it is directed for a specific sector, you know, that is as per the government requirement. But that doesn't actually remove the humanitarian aspect of ضمان itself. ضمان actually existed to provide the quality healthcare services that we have.
Nice. That's really, because honestly, we that's the purpose of it, you know, because you don't want to be really seen as somebody just treating people for their money, treating people for their, you know what I mean? We are humans, and Kuwait is well known for its, you know, humanitarian, you know, definitely supplements, and we gave a lot, you know, and our God bless his soul, Amir, Sheikh Sabah Ahmed was one of the humanitarian leaders.
Yes, that is definitely. In fact, even though the company today exists to serve a specific segment, even, you know, any other segment, they are most than welcome. You know, even, you know, if I talk about Kuwaitis, if I talk about different classes, they have different, maybe different models and different charges. Or
but they are not going to be left alone, I mean.
We will never leave anyone in need alone. Definitely, we will work things out with it.
Amazing, Mr. Arab.
There is a social responsibility also for the company.
That's really what we're proud of.
One of the main things also, which is the social responsibility that we are aiming at, is the creation of jobs. ضمان is expected to create around 7,000 job opportunities. And we also are going to focus on the Kuwaitization, because that's part of the social responsibility of ضمان.
That's really great. It's really fascinating that it really covers mostly the most important services for the healthcare. And as you mentioned, a lot of rooms and beds in the hospitals, really a high quality hospital is going to be. So as a Kuwaitis, can we treat it in, you know, in...
Of course, of course. I mean, as I mentioned, it is not... The idea of the segment is for a fixed rate. That's the whole idea of the HMO. But for any other different classification or even for higher different types of services, Kuwaitis are most welcome. In fact, I invite them now to visit. They are there in Rajij and Hawali and Farwaniya at any time, at any moment. They can visit our facilities.
That's really amazing.
So ضمان cover, you know, the expats, not only, you know, the citizens. I mean, is that correct statement or I'm mistaken? ضمان, you know, definitely cover the expats only, or a citizen would be also treated in the hospital. Definitely citizens and expats.
The governmental decree that was the purpose of issuing ضمان is to target the expats with Article 18 and their families.
And their families.
So that is the governmental actually purpose, and it was for a purpose because, as I mentioned, to reduce the pressure on
the burden on the governmental, definitely. And you mentioned HMO. What's HMO stands for?
HMO is the Health Maintenance Organization.
Health
Maintenance Organization. It is a system that actually been practiced outside, and it originated in the States. As I mentioned, 1972, it was in Minnesota. There was a doctor that wanted to reverse the insurance. And instead of paying a lot of money to get the insurance coverage, he wanted to promote the prevention of the community, which will actually reduce the visits and the requirements of the treatment. And he actually incentivized the doctors for reducing the number of visits. So it's a total opposite.
Yeah, it's like, you know, the Arabic saying, you know, by prevention is better than treatment. You know, الوقاية خير من العلاج. Yeah,
that was the basic idea.
That's really amazing.
But actually, but the whole existence of ضمان is based on the government vision. It is actually the government that actually promoted the existence of ضمان.
That's really great. So, Mr. Thamer, as a part of a new Kuwait Vision 2035, how will the ضمان impact actually the healthcare sector in Kuwait?
The very and most important contribution that ضمان have for Kuwait, New Kuwait 2035 is to elevate the quality of the healthcare services that we have, reduce the burden on the government and mainly the Ministry of Health, the creation of the new job opportunities, local job opportunities for Kuwait. The costs also. It's not just the pressure of the services that the Ministry of Health is bearing today. There's also the cost, because health services, they have cost impacts and implication. So that is something that ضمان will actually reduce some of the financial burden on the Ministry of Health. These are the main objectives that will contribute into New Kuwait Vision 2035.
Nice. That's really great. You know, objectives. You know, we're talking about health, well-being, taking off the burden and, you know, the pressure, creating jobs, lowering the cost. That's really something. And, you know, definitely you can see it from 2035 vision. And but if we we want to definitely, it comes, you know, phases and phases. Mr. Arab, tell us, you know, definitely phase 1, phase 2. So if you take us through phase 1 in 2022.
The agreement with the Ministry of Health is that ضمان should establish the health network. What is the health network? The health network is to have minimum 5 primary health care clinics and 600 beds. So today we already have 3 clinics that are operating, and we are going to have a new one in Jahra in April, and the third one will probably be in Ahmadi in September.
Nice.
And the hospitals will be operational. We will actually, the contractor will hand over the hospitals in the third quarter of 2022. So before the end of this year, we would have completed all the requirements that the Ministry of Health mandated for us to start operating. Once that is done, then we're going to slowly remove all the expats from the government system to ضمان as we go, with a ramp up of the next 1 year or 2 years. For 2023-2024, we are going to increase our primary healthcare clinics to reach up to 12 to 15 across
the country.
Yes, across the country.
That's amazing.
Yeah.
So we're talking about, inshallah, in 2 to 3 years, definitely we will really take off a lot of pressure, you know, from the government.
Starting this year, actually.
Starting
this year and for the next 2 3 years.
That's really great, Mr. Thamer. It's really a lovely interview we had. It's really an interesting topic, Farid, because our expats are our brothers and sisters.
Yes.
And we need that equality between Kuwaitis and expats.
Absolutely, Mr. Thamer Arab, that was really a pleasure and, you know, honor to really explain this and how it is going to be really beneficial for, you know, our beloved state of Kuwait. Thank you very much.
Thank you so much. I want to take this opportunity to really thank you again for having me to explain about ضمان. I want to also thank KTV2 for this lovely show. And I also want to expand my gratitude to the government and mainly to the Ministry of Health for all their contribution and cooperation.
Definitely.
Thank you so much.
Thank you very much, Mr. Arab.